What if I told you that finasteride you're worried about might be safer than you think? Today I'll be talking about the medication of its surrounded by controversy. Is it truly dangerous or have misconception clouded its reputation? So what is finasteride? It's a synthetic 5-alpha reductase inhibitor made in 1984. It was initially made to reduce prostate enlargement and treat benign prostate hyperplasia. In 1997, a lower dose formulation called prostatic was approved for male pattern hair loss. The drug works by blocking conversion of testosterone into DHT, a hormone linked to both prostate growth and hair follicle loss. Reports are cited about potential side effects, ranging from sexual dysfunction to psychological issues. Let's break down what the research says. The first claim is that finasteride causes permanent sexual dysfunction and reduces libido, but may not resolve even after stopping the drug. Here's what the science states. Large randomized controlled studies indicated that sexual side effects occur in only a small fraction of users. Example, clinical data report that decreased libido is experienced in roughly 1.8% of finasteride users versus 1.3% on placebo. And erectile function is about 1.3% versus 0.7% with placebo. A placebo is a fake treatment that helps people feel better just because they believe in it, even though it doesn't do anything, meaning that such differences are negligible, and importantly, these adverse effects are typically reversible upon discontinuation of medication for about a month. Second claim is that finasteride leads to permanent infertility by reducing sperm count. Studies that examined semen parameters in men taking finasteride have demonstrated that any reduction in sperm count are typically small and reversible. Most men experience normalization of sperm parameters after discontinuing finasteride. Moreover, the lower dose, 1 mg formulation, prescribed for hair loss is associated with far lower risk than the higher dose used for other indications. In order to have a baby, you should stop taking finasteride for at least a month. After conception, you can start taking it again. Third claim is that finasteride causes gynecomastia, or the enlargement of breast tissue. The evidence and debunk. Clinical trials and observation data indicate that the risk of gynecomastia is very low, typically around 1 to 1.5% of users, and the condition is generally reversible when the medication is discontinued. The fourth claim is that finasteride causes depression and suicidal thoughts. The UK's Medicine and Healthcare Products Regulatory Agency issued a reminder about the potential risks. However, a study published in JAMA Dermatology found no significant signals of suicide associated with finasteride use. The fifth claim is the persistence of post-finasteride syndrome. Some users report a consultation of symptoms, for example, persistent sexual dysfunction, mood changes, and brain fog, that continue after stopping finasteride. Before clinical studies and meta-analysis find that such persistent adverse effects occur in only a very small percentage, typically less than 2%. Many of the published case areas rely on self-report and are subject to selection and recall biases. For example, while regulatory databases show reports of persistent sexual and mood symptoms, the overall risk is very low compared to millions of users. Long-term studies provide more clarity. Research from the prostate cancer prevention trial indicate that finasteride not only reduces the risk of prostate cancer, but is also safe to use over extended periods. The study found no increased risk of prostate cancer death in men who took finasteride compared to those who did not. So the key takeaway: while finasteride, like any medications, causes potential side effects, extensive research indicates that it's generally safe for most users. Being informed and consulting with a doctor can help lower the concerns and ensure the best outcome. From a person who has taken finasteride for about 7 months, I recommend taking finasteride 3 times a week, and thankfully, I have never experienced any side effects. If you find this video helpful, please like and subscribe.